Tyler Peterson, Division of Cardiovascular Medicine in the Mayo Clinic Health System. I really enjoy cardiovascular medicine because I think it allows me to get to know my patients over time. So there's a good doctor-patient relationship. And also there's some really neat real-time differences I can make in patients' lives. I can treat patients most of the time without having them have to go to a large tertiary center. But I also, if I need to, that is also within our grasp and our reach. Though I'm charged to treat their heart, oftentimes it's not the most important thing that's going on. And so trying to recognize how their heart fits into the whole person, and then how to go about trying to make that whole person better. My grandfather was a physician in a small town in northern Minnesota where I grew up. He was kind of a quiet, soft-spoken man with a crew cut. And he was very well respected with the community and by myself and actually my brother, who's also a physician. And he would tell us things like, 90% of what I do is listen to patients. He would talk about how when you came into the room to see a patient, one doctor had told him you should always sit higher than the patient so the patient knows you're in control. So he said ever since that day he always sat a little bit lower than the patient to make sure that they didn't think that was what he was trying to do. And so I think that his example of somebody who was kind and a good listener took part in his job with integrity was something that we really looked up to and wanted to try to emulate. My favorite thing about working with the Mayo system is that, as opposed to other places I've been, I think that the needs of the patients do truly come first here. I also really like working here because I have access to the wealth of research and expertise that is the Mayo Clinic. I know that if I can't find an answer for my patient, that 45 minutes down the road, there's another 150 cardiologists, most of whom I know well, and I can contact the appropriate person to get the answers that we need. Outside of work, I have 3 small children. They keep me busy pretty much all of my time. I used to do things like outdoor activities and reading books outside of medicine, and now I basically spend my time chasing small children around.